it's Liz Calloway over at 360 Healthcare, and I'm here with Dr. Janine Rummel. We are talking about custom orthotics. So maybe you are on your feet all day long, or you're experiencing some sort of pain or misalignment in your body. Custom orthotics might be something you should consider.
Absolutely.
And Dr. Rummel, can you tell us more about what custom orthotics is and who can it help?
Sure. So it can help anyone that stands.
Okay. That's all of you.
So unless you crawl, yes, that would be the majority of the population. So the reason we like orthotics is they're supportive. So they'll create a lot of shock
and these
absorption.
are some examples?
Yep, these are some examples of them. So they're nice and thin. They fit right into shoes. They give with the foot. I like this one especially because it does have kind of that like dry fit, wick away. So if you're someone that the foot sweats, so typically I fit a lot of athletes, people that run.
Are these something that, like for a woman, if she likes to wear pretty shoes or high heel shoes, is there something for them?
Yeah.
Ah, yay. Okay. So this is really important because some people just go to the pharmacy and just buy the one size fits all.
Yeah, absolutely.
But these you can custom fit. Now, do you need to get a different size shoe when you're using these?
Typically, no. These will go right into the shoes that you already have.
Okay.
And what's even nicer, since we live in Myrtle Beach,
yeah,
they do make custom flip-flops too, right? They've thought of everything.
I love that. Okay, so now if you have some kind of back pain or maybe you want to enhance your athletic ability,
absolutely,
you would call and make an appointment for a consultation to get started, but you have this little gadget here.
I do.
Yeah, so this is, you may not be able to get it on camera, but it's a device that you actually stand on.
Instead of our traditional mold or cast that people are used to, this is a 3D scanner that's going to use a laser to scan the bottom of the foot.
So it's a glass box, you stand on it, and then this reads.
That is what we would see.
Okay,
absolutely.
So what are you seeing here?
Right, so when we look at feet, over on this side of the screen is our ideal or optimal foot, which I see very little of because, again, we do live in Myrtle Beach, the land of barefoot and flip-flops that are not supportive.
Okay.
But in a perfect world, this is what we would like to see, some equal pressure between the heel and the ball of the foot. What I typically see are feet that look more like this, a lot of, and what we're assessing is 3 arches in the foot. A lot of times people think, oh, I have high arches.
So this is perfect.
That would be our optimal, yes.
Okay, and this is
less than perfect.
Now, what's wrong? I see there's a lot of red on the side
Absolutely.
Here. What does that mean?
So when we're looking at the foot, we look at 3 arches in the foot. One that's going to run along the outside, the inside, and then across the ball of the foot, creating a triangle. We say it's like a vault that actually holds the foot up, and then that's what's really supportive to the rest of the body every time that we take a step or we stand. What you're seeing that's really red here, that's called the lateral arch, or the outside of the foot. Typically, when we assess a foot, that's the first arch, and I'll use this word, and it's not nice, collapse. That's the first arch to collapse. As in, I can't give you any exercise to make the foot stronger that's going to make that arch come back.
And that's where
these come into play, because if we don't support it, just over time, it's going to progressively get worse and then create issues up the leg and then into the low back.
Some people already have issues.
And they don't have foot issues yet. So if we can correct it before it becomes foot pain, too, that's even better.
And I think a lot of people would be surprised that when they come in for a consultation or if they've been to a chiropractor before, there's a lot of hip adjustment going on. And the doctor often says, you know, you have a difference in length in your legs. How does that happen? Or is that an injury that we cause? Or how does that happen?
So we can have different reasons why one leg is shorter than the other, but what we most commonly see, we call that a functional short leg. So it's not anatomical. It doesn't mean the leg is actually shorter, but what's happening is the pelvis is pulling. And what's nice about especially the foot levelers, they have pelvic stabilizers in them. So it will actually make that difference of leg length.
So you're actually
out.
Not only addressing what symptom you're having, but you're actually correcting.
Yeah.
So that's even better.
Yeah.
And if you are not having any particular problem, which I'm sure is rare to find a perfect foot, but it would help you if you stand a lot. A lot of people have these jobs where they're standing on concrete or tile floor all day. How does that help those people?
So they've got built-in shock absorbers in them. So if you think of a concrete floor, tile floor, very solid.
Yeah.
No give, no niceness to us.
Yeah.
So absolutely, we want some kind of shock absorption underneath the feet That way we're supportive to the whole body, and that's what these are doing for us. So people that work in big warehouses, which there's a lot of those people in this area, these are, to me, vital.
Well, let me ask you this question then, because we'll spend a lot of money on orthotic shoes or maybe really expensive sneakers that say they have all these pressure point relievers in them. Why would we additionally need something like this?
Right, so we don't always need the fancy shoe, too. What's nice is that we can put this orthotic in any shoe, so then it ultimately can become what you want to purchase shoe-wise, because we've got the best foundation in the shoe.
You don't have to wear these big shoebox shoes.
Right, absolutely.
All right, now, do you do this for children as well?
We do.
Okay.
Yes.
All right, so men, women, children, and like you said, you have even custom-made flip-flops.
Yep.
If someone wants that, or these can go into sandals, or even high heels.
Yep.
Boots, sneakers.
You name it, yeah.
Golf shoes?
Yes.
Okay.
They actually even make specific custom orthotics for golfers.
But some people may say, oh, I don't need that. But have you found anyone that doesn't need this? I mean, everyone kind of like has a problem. By the time they get to your office, they're already feeling some kind of pain.
Right, or we can look at healthcare as being proactive and preventative versus reactive, because reactive is not any fun. That's when we already hurt.
Exactly.
If we could be preventative and never have had those issues that we have, that would be even better.
And of course, this is so high tech. You know, we've seen certain gadgets over in the local pharmacy. This is much more high tech.
Absolutely. And with this company, we're getting amazing customer service as well. So it's nice that they work one-on-one with us, so it is 100% customized to your foot.
All right. All right, well, that's all about custom orthotics here with Dr. Janine Rummel over at 360 Healthcare. If they want to call you to make an appointment, how do they do that?
Sure. You can call us here at 843-692-9243.
Or you can even just stop by and make an appointment, 4810 North Kings Highway in Myrtle Beach for 360 Healthcare.